It's actually a normal day today. I don't know. Sunday. I was busy at work. Holy crud. Taking calls all day. Maybe that's why I didn't feel too down today. I don't know. It was energetic. It was nice. It was a nice break. Maybe I felt like I was helping people. You know, like one-to-one, like one-on-one. Did a catheter today. I did a lot of charting. Charting's not that fun, but it's distracting. I watched a movie and enjoyed it. That was pretty good. It normally hasn't, man, that hasn't happened for weeks. Holy crap. I haven't been able to watch a movie for months. It's kind of nice. I don't know what triggered it. Maybe all of these therapy sessions are helping me after all. I don't know. I'm letting go of my bad. Maybe my body can only handle it so much before it needs to shut it out. Who knows? But it was nice. It was total relief. I don't know. It was a nice day. Man, there's nothing to talk about today. Holy crud. Nothing was bothering me today. Like I would try to think about stuff and it was there. I had clear thoughts. I don't know what I did differently. I still overate. I had a bout of not feeling good about that, and I'm totally gaining weight. Oh, I guess that's something to complain about. It's probably gonna hit me on another day, but you know, I totally feel like I'm gaining weight, and I know I'm getting older, but it's like no matter what I eat, I feel like I'm getting fatter every day. I feel like my base metabolic rate is like 200 calories. So anything over 2 pieces of bread and I'm done for the day, you know? I don't not eat. I mean, it's just, oh gosh. Even healthy choices, I feel like it's just, I don't know. Everything. I feel like I'm overeating all the time. And you know, calorie counting doesn't work. I mean, water diet works, but that's pretty extreme, you know? Like I'm never content with moderation. Like with eating, moderation does not feel like moderation. It feels like I'm overdoing it. Isn't that crazy? I know that's not real. But everything I put in my mouth, you know? Like it's not like I want to throw it up, I just feel like guilty eating all the time. That's an issue. That's totally a psychological issue. I know. That's some crazy stuff. I don't know. It's totally a eating disorder, I'm sure. Not just an overeating disorder, but like an actual, maybe that's part of the compulsion. But I have irrational fears or irrational thoughts that I place with it. I don't know. I'm sure there's a name for that I just don't know. It doesn't really matter, you know, even if you label it, it's like, I still do the action, right? And I still have the irrational fear, so, you know, labeling is good, you know, you can find more about it, maybe different ways to stop it, but I think it's rooted in my upbringing, it's rooted in my brain chemistry, it's rooted in a lot of things. I mean, there's some things we could do to stop that, but it's so frustrating. I don't have the attention span to do them, or to find them out, or to keep on anything that I would try, you know? Barring, bariatric surgery, which would be effective for me, and I have nothing against that, you know? I know a lot of people judge other people because they don't have control, but like, as someone who doesn't have control, I have no judgment against it. Some of us just, it's not like it's not even addiction to food, man. That's the thing. It's not just addicted to food. It's more than that. But people attach it. People judge, and it's usually people that don't have this issue. Don't have certain of these, I don't know, brain issues or these imbalances or these addictions or some of this trauma in their past. It's easy to judge. I don't know. A lot of nurses actually have to go through it. I think part of it's sedentary. A lot of nurses get bariatric surgery to help with their eating, and I think it's healthy. I think it's great. There's a reason why insurance pays for it. But and it's not just because nurses are sedentary. But when you go around and you start consuming people's emotions that you're working with, and you're seeing a lot of pain and suffering every day, you need to get away. Some nurses become drug addicts. Some nurses become alcoholics. Some nurses overeat when alcohol or drugs aren't really an option for them. And other nurses are normal. Or maybe they just push the feelings away. For me, it's just compulsion. When I stress out, it's just compulsive. It's not even just eating. I do compulsive things and impulsive things. I don't know. I think depression comes on harder. But not today, man. It was a break. Holy crud, it was a good day. I mean, I talked about eating, but all in all, I felt pretty solid. I loved it. It's like normal. Like I used to feel. Maybe when I was, I don't know, consuming new media, just all of those distractions. Maybe today was just a distraction, and I'll be back tomorrow to my new norm right now, which isn't a good norm. It's a depressed, anxious, lonely state. Oh gosh. I do function while staying super busy, I guess. That's problematic, I think. That can become problematic. When that fades and I'm older and I can't keep a job anymore, what do I do then? Die, pretty much. I think when I'm unable to stimulate things, my brain, I'll probably die pretty quick. When your body responds to stress and it grows and it makes new cells to stress, when we stop stressing our body, it starts dying. So that's what's waiting for me probably as soon as I stop working. Oh, that's a sobering thought that I don't want to think about.